So now we're going to do the laser around Camille's knee, and he's got pains on the knee which were starting on the outside. But quite often the patient will report pain on the outside, the inside, or just above the knee or just below the kneecap. It doesn't really matter where the problem is. So if you're trying to help the knee, it's the same process. You turn it on this way, and the light goes on to a variable position. And just as a comment, as long as this green light here is on, it's got the power. When the battery runs down, it's time to charge, the word battery flashes red, and then it's time to go charge it up again. Ordinarily, the charge might stay good for 5, 6, 7 days or more, depending how often you use it. So we've got it on, it's on variable. Now we're going to push the white button again to activate the light, and you see the lights flashing. Now for the knee, you just, same as the heel, you just take the laser, 1 or 2, whatever you have, and if it's 1, then you just, of course, have to move it all over the knee, like I'm doing this here, concentrating on the area where the pain was worse. In Camille's case, it was more on the outside of the knee joint, where the cartilage separates the femur from the tibia fibia through here. Now, if you have 2, it's just faster and more convenient. You're covering both sides of the knee, regardless of how little or much pain there is. And then you kind of roll down a little bit here, just below the patella, and you just keep moving the lasers around like this. You do not have to press it into the skin. Just touching the skin is fine. And you just keep moving the lasers around the whole knee area, rolling up to the top part as well, just where the ligaments, tendons come down to insert. So you're really covering the area of insertion, origin, and attachments, whatever you want to call it, of the tendons to the knee, the space where the cartilage separates femur from the tibia fibia, and you just keep moving the laser around these areas. Concentrating, in Camille's case, he was indicating that there was more discomfort on the outside of the knee. So we do this for each knee, and then if there's going to be a change, then the person will report a difference, normally within that day or the next day. And they'll report the difference as compared to how the knee usually feels.